Good evening, everyone. I hope everyone enjoyed their Thanksgiving break and they're ready to come back and finish this semester strong. The title of my presentation is Disaster Planning. Are you ready? And of course, it will be narrated by myself, Jalecia Smith, and this is in completion for the Health Information Management 5363 course at Texas State University. So I hope you all enjoy. With the attacks of September 11th, Hurricane Katrina, Hurricane Ike, Hurricane Sandy, an Ebola outbreak, and more recently, the potential of a flu pandemic, public attention has increasingly focused on the ability of our nation's healthcare system to respond to mass casualty incidents. In response to this concern, it is important for healthcare systems and facilities to be prepared in the event they're facing a disaster. Today, my hope is to give you all some insight into the world of disaster preparedness. So we will be going through a few objectives today, and they are as follows. The effects of disasters, the different types of disasters, the importance of being prepared, and steps to being prepared. Effects of disasters. While the list of effects of disasters could go on for days, I really wanted to make note of some specific ones, and they are high rates of multiple chronic conditions, limitations in activities of daily living, and instrumental activities of daily living, physical and cognitive disabilities, sensory impairments, and physiological stresses. And like I said, these are just some of the effects that disasters can have on the individuals involved. Different types of disasters. Many times, when we think of disasters striking hospital settings, we automatically think of natural disasters like hurricanes, tsunamis, or even earthquakes. But here is a list of just a few of the different types of disasters that may affect healthcare settings. Natural and man-made disasters, traumatic and explosive events, nuclear and radiological attacks, biological events, chemical events, and public health events. The importance of being prepared. The importance of being prepared really lies within the importance of the hospital facility. In most communities, the hospital is the center or sometimes the heart of the entire community. And without it, the community could find itself in a position that may pose more of a threat than the initial disaster. Next, when a facility takes the time to prepare for many types of disasters, it shows that they have really thought about the financial considerations that going through a crisis could bring about. Being prepared before a disaster results in less money being spent, which is always a great thing. And lastly, being prepared initiates a peace of mind, which is quite valuable when faced with random disasters. Steps to being prepared. From my research, I found that there are 5 main areas of focus surrounding the concept of being prepared for disasters in hospital facilities. Administration and planning. I posed the descriptions of each step in question format just to put things into perspective for you guys. For administration and planning, it is important that a committee is designated for all of the hospital's disaster preparedness events. The committee should keep an updated version of the plan as well as participate in regional planning groups to ensure that their current disaster plan aligns with the state expectations. Additionally, funds should be allocated in the budget for disaster preparedness. Education and training. It is important that the facility provides competency-based training on disastrous events to clinical and non-clinical staff. Additionally, the training must be in accordance with the Occupational Safety and Health Administration standards. Lastly, members should participate in drills in order to keep them on their toes. Communication and notification. It is important that a hospital facility has a mechanism in place for the rapid receipt and posting of public health alerts during an event from agencies such as Public Health, Poison Control, the Centers for Disease Control and Prevention, and etc. You also want to make sure that the facility has a system for staff information and call-in inquiries during an event. Additionally, you want to make sure that the emergency department has adequate internet access located within the department. Lastly, there has to be a procedure in place for providing patient tracking, because you always want to know where your patients are at all times. Staffing and support. You have to make sure that the hospital facility has a plan that addresses procedures for expanding staff availability during a disastrous event. Additionally, you must make sure that mental health support is available as a component of the care provided to staff in a disastrous event. It's always easy to automatically just jump to the patients and what the patients need, but you also have to be mindful of the individuals that are tending to the patients. Supplies, pharmaceuticals, and laboratory support. The hospital facility must have agreements in place for accessing additional supplies or medications from outside resources during the event. Additionally, the facility must have a laboratory support plan for managing during the event. So, what's the bigger picture here? In retrospect, after learning all of this information about disasters in the hospital setting and how they can affect individuals, I think it would be safe to say that disaster planning impacts all stakeholders, including providers and consumers alike. It impacts providers because these are the individuals who will participate in your planning committees and who actually service the needs of the patients before, during, and after the disaster happens. On the reverse side, it impacts the consumers because they're essentially paying for a range of services that should be able to be rendered in the case of a disastrous event or not. With the help of a solid disaster plan, these two characters are brought together in the end to overcome an event that could otherwise devastate the entire community. Here is a list of my references. Again, I hope you guys really enjoyed and learned something from my presentation. Thank you and have a great